Hi guys, welcome back to my channel. I'm Dr. Veena, a full-time NHS GP working in London. Today we're going to talk about contraception. You may need this to regulate your cycle or to prevent a pregnancy. I'm going to talk you through some popular forms of contraception that are used in the NHS, and hopefully this will help answer some of your questions and give you a good idea of what you might want. First thing to say is really think about your lifestyle. Are you someone who's going to be good with taking pills? Are you someone who already is very busy and might not be thinking about having children or family planning for the next 4 to 5 years? So that could mean you have options of using something more long term. Are you someone who has certain medical conditions where things may not be safe for you to use? So these are things to really consider with your doctor before you pick one that's best suited for you. A gentle reminder that this is just an information video. This should not be used as a consultation because it's important to really look at your own medical history to see what is safe for you. There are some factors that may prevent you from using some contraception, such as if you have a specific BMI, if you are a heavy smoker, if you've previously had certain cancers, or you have irregular vaginal bleeding. These are things that we really have to look into, and we may have to advise you specifically. So make sure you do speak to your GP. The only form of contraception that protects against sexually transmitted infection are the barrier methods, such as condoms. However, they are not 100% at preventing pregnancy. So that's something to keep in mind. The barrier methods can be condoms or diaphragms that can be used. When you're taking any of the hormonal contraception, it's important to remember they work by either preventing ovulation, so preventing an egg from being released from the ovary, coming down the fallopian tube and into the uterus, or by preventing implantation in the uterus itself. That's how they actually function. Another popular method is the pill. The pill has two common forms that are used. There's a combined pill, which has 2 hormones. This pill is taken every single day for 3 weeks, and in the 4th week, you get a bleed. This is really useful for women if you want to regulate your cycle or you like seeing a bleed that just kind of tells you, okay, things are ticking along nicely. And I know a lot of women who've been on this for many years, and it's actually worked really well for them. The combined pill, certain types, can also help with acne and irregular periods because it can help regulate your cycle, so you know you can expect a period every month. The other type of pill is the mini pill. This only has 1 hormone, progesterone. There are different types depending on which kind of progesterone there is, but how you take this one is every single day with no break. One of the common side effects of this one is that in 1/3 of women, you may get a light bleed, 1/3 may get a heavy bleed, and 1/3 may get no bleed at all. So you get an irregular bleeding pattern that we commonly see. Some women may get a bit of bloating or breast tenderness. However, there is no evidence that directly links any of these pills to weight gain. I know this is a big concern and women always come and ask me this, but there isn't any evidence to this. It might be anecdotal, or some women might feel that's what they've experienced, but they haven't been conclusive in terms of studies to find that out. The combined oral contraceptive, we talked about being in a pill form. However, they also can be in a patch form where you apply the patch either on the back of your shoulder or the arm, and you leave it on for a week, and every week you change it, and in the 4th week you have a bleed again. So the combined pill you take for 3 weeks and you get a bleed. The mini pill you take every single day and you just keep taking it. Other forms are more longer acting reversible contraceptives. So these would be things like the implant, which is inserted under the skin. It lasts for around 3 years. Again, it can cause a bit of irregular bleeding, a bit of breast tenderness. Once it's inserted, you don't then have to worry about conception for the next couple of years. You can also get contraceptives in forms of an injection, what we call as a depot. You get this injection every 8 to 12 weeks. So you have to see your doctor so he can prescribe it. And then you see the nurse once every 8 to 12 weeks where you get the injection. It's an intramuscular injection. So you might get it in your leg or in your arm. Longer acting reversible contraceptives can also come in the form of coils. Coils can be hormonal, and they're called the IUS, intrauterine system. They differ depending on the concentration of the hormone present in them. The popular ones are Jidess, Kylina, Mirena that we find on the market, and they're licensed for anywhere between 3 to 6 years. Non-hormonal coils are called the IUD, intrauterine device. We use a copper one. Copper is toxic to sperm. This can stay in anywhere between 5 to 10 years. When using the coil, specifically the hormonal coil, Some side effects might be bloating, a bit of cramping once a month at the time where you may have got your period, some difference in discharge that you get from the vagina. So it might be a bit darker, it might be a bit thinner. It's not going to be what your normal cycle used to be. Majority of women stop having periods after around 6 months. However, some women still get a light bleed when using the hormonal coil. When we think about the location, it's important to remember the coil does not sit in the vagina itself. It sits within the uterus. So one benefit of the coil, the hormonal one, is that it doesn't release any hormone into your bloodstream. It releases hormone around the uterus, and that's how it actually functions. So you may not get some of the systemic symptoms of mood swings or general tiredness and things like that. You are just going to have the hormone working on the uterus itself. If you're thinking about something more permanent, there's female sterilization, which is a surgical procedure that can be done, or there's a vasectomy for men. You can get free advice about all of this from the NHS contraception page, which I will leave down below. Have a read, have a look around, and really think what might be something you're interested in or what might suit your lifestyle. And you can take this back to your doctor to then discuss it at more detail. You can get free contraception also from any sexual health clinic in the UK. Some of them are walk-ins, some of them you have to book an appointment for, and they'll ask you some similar questions, make sure it's safe for you to take it, and they can proceed with giving you the contraception. While we're talking about contraception, it's also useful to just mention emergency contraception. If you've had unprotected sexual intercourse and are worried that you may have already ovulated and you could be pregnant, there are a couple of things you can do. You can go to your local pharmacy or your GP and they will have a consultation with you, make sure it's safe for you. There are 2 different pills that could be given to you that work up to 5 days after the incident, or you could also have a copper coil inserted. The 2 main types of emergency pills used in the UK are Levanel, which works for up to 3 days after unprotected sexual intercourse, or Ella1, which can work up to 5 days afterwards. I hope this video helped shed some light on the different types of contraception available, and I hope you go away from this a bit more knowledgeable and with a bit more understanding of what might be best suited for you. Please feel free to leave any questions you have down below. I will do my best to answer them, but remember, I can't give any personalized medical advice. Thank you so much for tuning in.